Atrial fibrillation is actually the most common heart rhythm abnormality seen in human adults. Basically, what it means is that the upper chambers of the heart, instead of beating in a very regular, organized fashion, beat very rapidly and uncontrollably, and actually not even generating a proper squeeze, but just what we call fibrillating or quivering without any control at all.
The two things we worry most about with AFib patients are stroke risk and development of heart failure. The biggest complaint with atrial fibrillation is poor quality of life, inability to do the things that you typically can do. No longer able to walk up a flight of stairs without stopping and catching your breath. No longer able to walk a block with your grandchild because you're short of breath.
They'll describe symptoms like a fish flopping around in their chest, or secondary symptoms like shortness of breath or chest pain. The simple answer is that no two people present an atrial fibrillation in exactly the same way.
As people get older, there's an increasing incidence of atrial fibrillation. In many ways, it is a wear and tear rhythm on the heart. So through decades of life, it is a stress to the atrium, and it can lead to these triggered arrhythmias.
Then there are other medical conditions that an individual may have that makes atrial fibrillation more likely. For instance, being overweight is a big one. And some of the side effects of being overweight, like having sleep apnea, those can be significant risk factors that bring atrial fibrillation on earlier than it may otherwise have happened. So diagnosis of atrial fibrillation can be suggested by the way a doctor listens to your heart, but the best way to make the diagnosis is with an ECG, or an electrocardiogram. That's a simple doctor's office-based test where a few stickers are placed on the chest, and electrical activity from the heart is measured and used to generate a printout on a piece of paper. An ECG takes about 5 minutes to obtain. It's completely non-invasive, it's safe, and it's definitive, meaning with an ECG in hand, then somebody with atrial fibrillation will make the diagnosis right then and there.
What are the best treatment options for atrial fibrillation? It is very patient dependent. The pillars are focused on stroke risk protection and managing symptoms. Through what methods we use to achieve both of those goals varies dramatically between patients. In symptom management, it can be medications or lifestyle changes, or catheter ablation, or surgical treatment. It really relies on what the symptoms are and what are our targets for therapy. So what MedStar has to offer is really a collaborative effort between both electrophysiologists, cardiologists, pulmonologists, cardiac surgeons. We have a team approach, and we also have the ability to offer all updated and current technology. So we have the most advanced systems, labs, and training to manage atrial fibrillation.
So thanks to the benefits of modern technology that we have today, we have a whole series of therapies available to us to stop atrial fibrillation. MedStar's Heart Rhythm Service, or MedStar Cardiac Electrophysiology, now is able to reach patients throughout the Maryland, even southern Pennsylvania area, all through central Maryland and the District of Columbia and southern Maryland, all the way to the Eastern Shore and throughout Northern Virginia. Our network of over 20 offices throughout this region is able to bring heart rhythm expertise close to home.
This is not the time to discount care for your abnormal heart rhythm. If you have signs or symptoms to suggest atrial fibrillation, it's very important to both make the identification of the rhythm and then develop a strategy for treatment.
Heart conditions aren't taking a break during the pandemic. We need to make sure that we continue our care similarly without interruption.